Welcome back to Chapter 16 lecture. This is part 2. We left off after the comprehension check number 2, and now we are on medications that promote blood cell development. So hemopoietic stimulant medications stimulate the growth of blood cells. And these stimulant medications, the growth of blood cells, are used to treat patients with anemia, and this could be caused by chemotherapy, iron deficiency, or genetic disorders. It's interesting to note that in chemotherapy, patients have lowered blood levels due to bone marrow suppression, and therefore we use the hemopoietic stimulants in this case. So the force of the heart's contraction, the amount of blood that is pumped, and the resistance or give of the blood vessels all influence the blood pressure. And the kidneys also play a key role by regulating how much volume is circulating. Hypertension is a major cause of death and disability. So chronic high blood pressure can reduce the kidney's ability to get rid of excess fluid, and thus this puts a strain on the circulatory organs. It can be caused by poor heart action, arteriosclerosis, kidney failure, narrowed blood vessels, chronic stress. And again, it is the major cause of death and disability. So arteriosclerosis is fatty plaque in the arteries, and chronic hypertension reduces the kidney's ability to remove excess fluid, which is why this straining occurs on the circulatory system. Antihypertensive medications include angiotensin and this converting enzyme or ACE inhibitors, and these block the renin-angiotensin pathway from the kidneys to decrease blood pressure. The autonomic nervous system agents, the alpha and beta blockers, and these act on the alpha and beta androgenic receptors to relax the flight or fight stress response. Diuretics that regulate blood pressure by encouraging the kidneys to excrete fluid, and also include calcium channel blockers that block calcium from passing into the heart muscles and the blood vessel walls. So here on this slide, you see the angiotensin converting enzymes, or the ACE inhibitors, and they stop the enzyme that converts the angiotensin 1 to the angiotensin 2, which stops the constriction of blood vessels. So some examples here would be the captopril or the fasenopril. Sorry for the delay. I'm trying to click on there we go. Okay, so then we talked about the angiotensin receptor blockers, the ARBs, and these block actions of angiotensin, thus preventing constriction of blood vessels. These are used when ACE inhibitors are not tolerated by the patient. Some examples might be eprosartan or losartan, and you'll be working on these during your essential reviews. Now let's look at the autonomic nervous system agents. The beta adrenergic blockers, these decrease the fight or flight response, and some of these that you might see would be atenolol or bisoprolol. So the fight or flight response it constricts the blood vessels, which then increases the heart rate. So we'll look at diuretics now. So these clear excess fluids from the body. So decreased peripheral vascular resistance occurs, and thiazide diuretics are most common class of diuretics. Chlorothiazide and hydrochlorothiazide would be examples of this. So potassium sparing diuretics are basically that. They spare the potassium They interrupt the sodium-potassium exchange. And loop diuretics are the most potent form of diuretics. Loop diuretics act at the ascending limb of the loop of Henle in the kidney, and they are primarily used in medication to treat hypertension and edema, often due to congestive heart failure or chronic kidney disease. Loop and thiazide diuretics cause a loss of valuable potassium. We, in our nutrition unit in ALH4, we talked about essential things that our body needs, and therefore they do require supplemental potassium. That brings us to comprehension checkpoint number 3, and here's the question. The electrolyte that is critical to function of the heart lost with diuretic is the electrolyte that is critical to the function of the heart lost with diuretics is, and you are correct, that is potassium. And we talked about potassium and the need for supplements. Calcium channel blockers block calcium ions, dilate heart vessels, and thus decrease the workload of the heart. These are generally used for patients with very rapid arrhythmias. Amlodipine and nifedipine are examples of this medication. It's also important to note here that there are non-medication ways to decrease blood pressure, and this would be things like weight reduction, decreased sodium and alcohol intake, and reduced stress, and then increased exercise. Those are all non-medication ways to decrease blood pressure. Let's talk a little bit about congestive heart failure. CHF is congestive heart failure. This occurs when the heart muscles weakened and can no longer push a normal amount of blood through the body. The kidneys do not receive enough blood and fluid does not get flushed out of the body, and this causes buildup and puts an even greater strain on the heart. Drugs used to treat congestive heart failure include vasodilators. These decrease the amount of pressure the heart has to pump against, and cardiac glycosides that help the heart beat stronger and more efficiently. ACE inhibitors, angiotensin receptor blockers, beta blockers, and diuretics are also used to treat congestive heart failure. Lifestyle changes can decrease the symptoms and risk of complications with congestive heart failure. I apologize, I didn't give you examples on this, so I just went back. Hydralazine or isosorbide mononitrate would be examples of vasodilators. Cardiac glycosides are used. These are used to help the heart beat stronger and more efficiently with congestive heart failure. It's ideal to combine with medications that decrease the peripheral vascular resistance, and digoxin is one of these. Patient teaching that's included with digoxin is to have the patient check their heart rate and make sure that they are holding medications for heart rates less than 60 beats per minute. Also used for congestive heart failure are the ACE inhibitors that we talked about, the angiotensin receptor blockers, the beta androgenic blockers, and the diuretics. And these are all utilized to treat congestive heart failure as well. Now let's discuss abnormal heart rhythms. So causes of abnormal heart rhythms could be hypertension, cardiac valve disease, coronary artery disease, potassium level alterations, heart failure, diabetes, stroke or myocardial infarction, and also certain medications. Drugs used to treat heart rhythm irregularities, the irregularities are known as dysrhythmias or arrhythmias, and these drugs are classified by how they act to improve heart rhythm. Sodium channel blockers are class 1 antiarrhythmics. Beta androgenic blockers are class 2 antiarrhythmics. Potassium channel blockers are known as class 3 antiarrhythmics, and calcium channel blockers are class 4 antiarrhythmics. Sodium channel blockers treat supraventricular rhythms by slowing the rate of electrical conduction and by inhibiting sodium. Beta androgenic blockers slow electrical conduction in the heart and decrease oxygen demands for the heart by decreasing the fight or flight response. Potassium channel blockers affect potassium to successfully treat both ventricular and supraventricular arrhythmias. Calcium channel blockers block calcium ions, dilate the heart vessels, and thus decrease the workload of the heart. These are generally used for patients with very rapid arrhythmias. So we're going to go through those slides now so that you can take a look at each of those. The beta androgenic blockers, class 2s, potassium channel blockers, class 3. Calcium channel blockers, class 4. Medications for shock. First, we need to know what shock is. Shock is the collapse of the cardiovascular system, and it can be from different origins. So it could be cardiogenic in origin, which is where the heart stops pumping. It could be hypovolemic in origin, which is loss of blood volume. It could be neurogenic in origin, where the central nervous system fails, and this leads to vasodilation. Or it could have a septic origin, and this is an invasion of a microorganism. Shock affects every portion of the body. Your metabolism slows, the urine output decreases, blood pressure lowers, heart rate increases, respirations are rapid and shallow, and anxiety, confusion, lethargy, and restlessness occur. Treatment for shock targets the underlying causes as well as supports the cardiovascular system while that cause is treated. So drug therapy to support the cardiovascular functions include the vasopressors to increase blood pressure, and then the inotropic drugs, which we'll look at here. So for vasopressors, epinephrine or norepinephrine or dopamine. The inotropic drugs are used to strengthen the contraction of the heart and increase the cardiac output. Dobutamine is an example of this medication. That leads us, yay, to comprehension checkpoint 4. We're almost finished. Thanks for hanging in. This is the type of shock caused by invading microorganisms is, the type of shock caused by invading microorganisms is, and you are correct. The answer is D. Septic shock is caused by overwhelming infection, which is caused by invading microorganisms. I think it's also important to talk about anaphylactic shock here. Anaphylactic shock is caused by an overactive response to an allergen. This causes breathing difficulty, bronchoconstriction, decreased cardiac output, and it's important here that also it can cause edema, increased heart rate, hives, itching, vasodilation. It can be deadly, and sometimes an EpiPen, so the vasopressor, the epinephrine, is used So with patients with life-threatening allergies, they're advised to carry the EpiPen at all times